Hello, this is me, Dr. Tanya Hashik. So today's topic of discussion is movement of joints, part 2. So we have already discussed about flexion and extension. Now we will discuss about all other movements of the joints. So the first topic here is abduction and adduction. So it is a movement that takes place in coronal plane. So we have already discussed what a coronal plane is. A coronal plane is a plane that divides body into an anterior and posterior half. That is, it is also called as frontal plane. So abduction and adduction are movements that takes place in this plane. So it involves medial and lateral motion of limbs, fingers, toes, thumb, etc. You know what is medial and lateral motion. So it involves medial and lateral motion of limbs, thumbs, fingers, etc. That is moving away from the body and moving towards the body. So abduction and adduction of the limb is, abduction is moving the limb laterally away from the midline and adduction is movement of limb towards the midline. So abduction means moving laterally away from the midline and adduction means movement of limb towards the midline. So we have already discussed that abduction and adduction are motions that takes place in limbs, finger, toes, thumb, etc. So now we will discuss an example for abduction. So abduction, it is the raising of arm at shoulder joint, that is moving laterally away from the midline. So example for abduction is raising of arm at shoulder joint. In the figure you can see abduction, that is raising away of shoulder from the midline, and the adduction is bringing back down towards the side of the body, and in another figure you can see the adduction, that is bringing back down towards the side of the body. So it occurs in wrist, toes, thumb, etc. In circumduction, it is a movement of a body region in a circular manner. That is circumduction. It is a movement of a body in a circular manner, and in circumduction, one of the end of the body region being moved is relatively stationary compared to the other end, which describes a circle. That is, in circumduction, one of the body region, even if it is moving, it is relatively stationary compared to the other body region, which describes a circle. So in this figure you can see circumduction. So circumduction is a combination of flexion, adduction, extension and abduction. So we have already discussed that in circumduction, one end of body region is relatively stationary compared to other end, which describes a circle. So in this figure you can see that, and in circumduction it involves four motions, that is flexion, adduction, extension and abduction. So rotation, it is a movement that occurs in pivot joint and the ball and socket joint. And example for rotation is rotation of neck. In rotation of neck, it is the atlanto-axis joint. So a rotation of body and neck is a twisting movement that occurs by the summation of the small rotational movement that is available within adjacent vertebra. That is, it is the sum total of small rotational movements that is available in adjacent vertebra. So in the figure you can see rotation of neck and also medial and lateral rotation of thighs. In medial and lateral rotation of thigh, the ball and socket joint is involved. So another example for rotation is the proximal radio-ulnar joint. So it occurs during the supination and pronation. So we will discuss what supination and pronation is in the next slide. So another example for rotation is the proximal radio-ulnar joint. Pronation and supination. So it is a movement of forearm. So it can be best described when a person is standing in the anatomical position. We have already discussed what anatomical position is. So in anatomical position, the palm will be facing forward. So that position is a supinated position of palm, and the opposite of that is when palm is facing backward, it is called as pronation. So pronation and supination, it is a movement of forearm, and it is best described when a person is standing in the anatomical position. So when palm is facing forward, it is called as supination, and the opposite of that is palm facing backward, is called as pronation. So now we will discuss about dorsiflexion and plantar flexion. So dorsiflexion is a movement that occurs within the ankle joint. So ankle joint is a hinge joint. So what is a dorsiflexion? It is a lifting of the front of the foot so that top of the foot moves towards the anterior of the leg. So that is called as dorsiflexion. That is lifting the front of the foot so that the top of the foot moves towards the anterior of the leg, is called as dorsiflexion. So plantar flexion, it is a lifting of heel of the foot from the ground and toe pointing downwards. That is called as plantar flexion. That is lifting heel of the foot from the ground and that is toe pointing downwards, is called as plantar flexion. So the next movement is inversion and eversion. These are complex movements. So in inversion, it is the turning of foot to angle the bottom of foot towards the midline, is called as inversion. That is, the bottom of the foot is towards the midline. It is called inversion, and eversion is the opposite of that. That is, turning the foot away from the midline is called as eversion. In the figure, you can see both inversion and eversion. So the next movement is protraction and retraction. It occurs in shoulder and also in mandible. That is the lower jaw. So in shoulder, it is when shoulder is moved forward, it is called as protraction, and when shoulder is moved backward and medially, it is called as retraction. So now we will discuss protraction and retraction in mandible or the lower jaw. So in lower jaw, when lower jaw is pushed to stack out chin forward, it is called as protraction, and when lower jaw is pushed backward, it is called as retraction. So when lower jaw is pushed forward, it is called protraction, and when lower jaw is pushed backward, it is called as retraction. So now we will discuss about depression and elevation. So it occurs in both shoulder joint and also in mandible. So now we will discuss about mandible. So elevation in mandible is the upward movement of the lower jaw, and depression of mandible, it is the opening of the mouth or the downward movement of the lower jaw. So elevation, it is the upward movement, and depression, it is the downward movement. So now we will discuss the excursion. So what is excursion? It is the side-to-side movement of the mandible. So the side-to-side movement of the mandible is called as excursion. So in the figure you can see what excursion is. It is the side-to-side movement of mandible. So the next movement is opposition and reposition. So opposition, it brings tip of thumb in contact with tip of finger. So in the figure you can see opposition, that is tip of thumb is in contact with tip of finger. So in reposition, returning thumb to its anatomical position is called as reposition. In the second figure you can see reposition. So this is the end of this video. For more videos, please subscribe to my channel and press the bell button.